Measles, once a common childhood illness, is a highly contagious viral infection that can have severe and lasting impacts on different demographic groups, including children, elderly individuals, and pregnant women. In this blog post, we will explore the long-term effects of measles infection on these vulnerable populations, the potential complications and risks involved, as well as the effectiveness of vaccines in preventing this disease. Children are often the most impacted by measles, as they have not yet developed a robust immune system to fight off the virus. In severe cases, measles can lead to pneumonia, encephalitis, swelling of the brain, and even death. The virus can also cause long-term damage to a child's respiratory and immune systems, leaving them more vulnerable to other infections in the future. Additionally, measles can result in hearing loss, vision problems, and cognitive deficits in children who have been infected.
Elderly individuals are also at risk for serious complications from measles, as their immune systems may not be as strong as they once were. The virus can lead to pneumonia, bronchitis, and other respiratory infections that can be life-threatening for older adults. Measles can also exacerbate existing health conditions, such as heart disease or diabetes, making it even more dangerous for this demographic group. Pregnant women are particularly susceptible to measles due to changes in their immune system during pregnancy. The virus can lead to miscarriage, premature birth, or low birth weight in babies born to mothers who have been infected. Measles can also increase the risk of complications during childbirth, such as hemorrhage or infection, putting both the mother and the baby at risk. The long-term effects of measles infection can be devastating, but the good news is that vaccination can prevent this disease and its complications. The measles vaccine is highly effective at protecting individuals from the virus, with 2 doses providing lifelong immunity in most cases. Vaccination not only protects the individual who receives it but also helps to prevent the spread of the virus within the community, leading to herd immunity that can protect those who cannot receive the vaccine, such as infants or individuals with compromised immune systems.
According to the U.S. Center for Disease Control and Prevention, CDC, there may be severe complications in children and adults who get the measles, including death. Some people may suffer from severe complications, such as pneumonia, infection of the lungs, and encephalitis, swelling of the brain. They may need to be hospitalized and could die. Hospitalization. About 1 in 5 unvaccinated people in the U.S. who get measles is hospitalized. Pneumonia. As many as 1 out of every 20 children with measles gets pneumonia, the most common cause of death from measles in young children. Encephalitis. About 1 child out of every 1,000 who get measles will develop encephalitis, swelling of the brain. This can lead to convulsions and leave the child deaf or with intellectual disability. Death. Nearly 1 to 3 of every 1,000 children who become infected with measles will die from respiratory and neurologic complications. Complications during pregnancy. If you are pregnant and have not had the MMR vaccine, measles may cause birth prematurely or have a low birth weight baby.
For those who get measles, there may be long-term complications. Subacute sclerosing panencephalitis, SSPE, is a very rare but fatal disease of the central nervous system. It results from a measles virus infection acquired earlier in life. SSPE generally develops 7 to 10 years after a person has measles, even though the person seems to have fully recovered from the illness. Since measles was eliminated in 2000, SSPE is rarely reported in the United States. Among people who contracted measles during the resurgence in the United States in 1989 to 1991, 7 to 11 out of every 100,000 were estimated to be at risk for developing SSPE. The risk of developing SSPE may be higher for a person who gets measles before they are 2 years of age.
While the measles vaccine is generally safe, there are some potential side effects that individuals should be aware of. Almost all medications have some side effects, even aspirin. Common side effects include a mild fever, rash, or soreness at the injection site. More severe reactions, such as allergic reactions or seizures, are rare but can occur in some individuals. It is important to discuss any concerns or questions about vaccination with a healthcare provider to address any specific risks or benefits for each individual. In conclusion, measles can have a significant impact on different demographic groups, including children, elderly individuals, and pregnant women. The long-term effects of measles infection can be severe and even life-threatening, making vaccination a crucial tool for preventing this disease. By understanding the risks and complications of measles, as well as the benefits of vaccination, we can work towards promoting public health and protecting vulnerable populations from this preventable disease. Let's all do our part to keep our communities safe and healthy.